Exposure therapy is a therapeutic technique rooted in behavioral psychology that involves gradually exposing individuals to feared stimuli or situations in a controlled and systematic manner. By confronting these fears in a safe environment, individuals can learn to tolerate and manage their anxiety responses, leading to symptom reduction and improved functioning. Exposure therapy follows a hierarchical approach, starting with less anxiety-provoking stimuli and gradually progressing to more challenging ones as individuals build tolerance and confidence. Through repeated exposure to feared stimuli without the associated negative consequences, individuals learn that their feared outcomes are unlikely to occur, leading to a reduction in anxiety over time. In certain cases, exposure therapy may incorporate response prevention techniques, where individuals refrain from engaging in avoidance behaviors or safety-seeking strategies during exposure exercises, allowing for full emotional processing. Exposure therapy utilizes a variety of techniques to facilitate fear extinction and promote adaptive coping. In vivo exposure involves real-life exposure to feared stimuli or situations. For example, someone with a fear of heights may gradually expose themselves to increasing heights, starting from standing on a chair to eventually standing on a tall building. Imaginal exposure involves vividly imagining feared scenarios or stimuli in detail. This technique is particularly useful for addressing traumatic memories or fears that are difficult to replicate in real life. VR exposure allows individuals to experience immersive situations or feared situations in a controlled environment. It's especially helpful for addressing phobias or situations that are challenging to replicate in vivo. Interoceptive exposure involves deliberately inducing physical sensations or symptoms associated with anxiety, such as rapid heartbeat or shortness of breath, to reduce sensitivity and fear of these sensations. Exposure therapy is highly effective in treating various anxiety-related disorders. Whether it's fear of heights, spiders, or flying, exposure therapy helps individuals confront their specific fears and gradually build confidence in facing them. Exposure therapy, particularly with prolonged exposure, assists individuals in confronting and processing traumatic memories, reducing symptoms of avoidance and hyperarousal. Exposure and response prevention, a specific form of exposure therapy, enables individuals to confront obsessive thoughts and resist compulsive behaviors, leading to symptom reduction. Individuals with panic disorder can also confront physical sensations associated with panic attacks, reducing the fear of these sensations and decreasing the frequency and intensity of panic attacks. Exposure therapy has a profound impact in helping individuals confront their fears, break free from the cycle of avoidance, and reclaim their lives. By embracing the principles and techniques of exposure therapy, we can empower individuals to step bravely into the unknown and emerge stronger and more resilient than before.